Alrighty, well, good afternoon, everyone, and welcome to this informational webinar on Social Security Disability Benefits and PA-ABLE, hosted by U.S. Senator Bob Casey's office, the Social Security Administration, and PA-ABLE. We're grateful for everyone taking the time to join this call today. I want to start by introducing myself and the other panelists on this call. My name is Andrea Guscott, and I am one of Senator Bob Casey's constituent advocates. Also on this call from Senator Casey's office is constituent advocate Maria Hernandez. From the Senate Aging Committee, we have Michael Gamble McCormick joining us. From the Social Security Administration, we're excited to introduce Jessica Sylvant, who is Social Security's Public Affairs Specialist. From PA-ABLE, we're excited to introduce Diana Fishlock, who is the PA Bureau of Consumer Programs Outreach Specialist. We're grateful for all of our panelists' willingness to join our office for today's webinar. Before we get started, I will quickly note that if you have any questions, please hold them until the end of the presentation when we will have a Q&A session. We ask that you please keep your questions general and applicable to as many people as possible, since this is a public call. If you have questions regarding your own specific situation, contact information for Senator Casey's office will be provided during the presentation for you to reach out to directly. And at this time, I'm going to turn the call over to Jessica with Social Security to delve more into the specifics.
There, everyone, and thank you, Andrea. Good afternoon to everyone on the call. As Andrea said, my name is Jessie Sylvant, and I am a Public Affairs Specialist with the Social Security Administration. I've been with the agency for 14 years. I've held many different roles, including claims specialist, technical expert, supervisor, and most recently moved into the public affairs role about a year ago. And today I'm going to be covering many programs and services that Social Security offers to individuals with a focus on our disability programs, the application process, and the eligibility factors. We'll go ahead and get started. Next slide, please. Okay, so Social Security has 4 main programs that are funded by the Retirement Survivors and Health Insurance Trust Fund, which is generated by the FICA or Social Security tax collected on working individuals' wages. The first being retirement, which is a monthly benefit payable to individuals who are a minimum age of 62 and have enough quarters paid into Social Security to be insured for the program, which is a minimum of 10 years of work. Secondly, we pay survivor benefits to individuals who have been predeceased by a spouse or a minor child who had a parent who worked enough in their lifetime to qualify for benefits. Additionally, we have a disability program for individuals who have a physical or mental impairment that they expect to prevent them from working for 12 months or longer. And you'll see the SSDI and SSI in parentheses. We have 2 disability programs. The SSDI program is based on your working earnings, where your monthly payment is derived from your recent earnings history. And the SSI disability program is a federal welfare program for disabled individuals who have limited income and resources, and there's no work requirement for this program, and I will be discussing each of these programs in much greater detail. But finally, there's Medicare, which is a federal health insurance program in which Social Security assists individuals with enrollment for Part A and B. Next slide, please. So to meet Social Security's definition of disability, an individual must be unable to work at a substantial level due to a medical condition that they expect to last at least 12 months or longer, or end in death. So our disability program is what would be considered more of a long-term disability program. And you might be asking yourself, what is substantial work? Which is basically a way Social Security evaluates your ability to work. There's a cap to what you can earn if you're working while you apply for disability benefits. The monthly amount for 2023 is $1,470 gross. So if someone is still working while they apply for disability, we will ask questions about their work activity and evaluate it to determine if it's considered substantial by Social Security's definition. Next slide, please. Now, as I mentioned, there are two disability programs through Social Security that function a bit differently and have varying rules and eligibility factors to qualify. So first we'll begin with SSDI, also known as the Title II program. You'll see that on the left-hand circle in blue. And that's an insurance program based on an individual's working earnings. And the benefit amount will vary dependent on how long they worked and how much they made and paid into the FICA tax, again, which is the Social Security tax. And Medicare is the federal health insurance program individuals become eligible for after 24 months of entitlement to disability benefits. And then our other program in the right-hand circle in red is SSI, also known as Supplemental Security Income, or Title 16, and that is our needs-based disability program based on income and resources. For single individuals, the income and resource limit is $2,000 per month, and for married couples, $3,000 per month. And Medicaid is a state health program for people with low income and limited resources. And in many states, including Pennsylvania, Medicaid does come automatically with SSI eligibility, as Social Security automatically notifies the state Medicaid office upon determining that an SSI applicant does become eligible for SSI. Next slide. So this chart reiterates what I talked about on the prior slide. These are the major differences and eligibility factors for each disability program. So you'll see one of the major differences is that the SSDI program does not have a cap or limit to income or resources, with the exception of earnings from work, where SSI does, as it's a needs-based program. So any other income or resources you may receive from other sources, which I will discuss shortly, will impact your eligibility for that program. Now, additionally, the Social Security program has a benefit that is payable to disabled adult children who are at least 18 years of age and became disabled prior to age 22. And for this benefit, the disabled adult child can either qualify based on their own work and earnings or on the record of a parent who receives either retirement, disability, or is deceased but worked long enough to be insured for Social Security prior to their death. And the SSI program also pays benefits for children under age 18 who are in financial need and have limited income and resources. And SSI can pay benefits to individuals age 65 or over who do not need to meet Social Security's definition of disability. However, they must fall within the designated income and resource limit for the SSI program, and that is referred to as an SSI aged benefit. Next slide. Now, there are two different earnings requirements that one must meet to qualify for Social Security disability. And when we talk about a work test, what we mean is how much you earned leading up to the point you became disabled. So for SSDI, the amount of work you need to be eligible depends on both your age and how much work you have paid into Social Security. Now, you earn a quarter of coverage or a credit for every $1,640 of earnings that are subject to the FICA or Social Security tax, and you can earn up to a maximum of 4 credits per year. So to have earned 4 credits in 2023, you would have had to have earned a minimum of $6,560. Next slide. So this table shows examples of how much work you need to meet the duration of work test if you become disabled at various ages. For example, an individual who becomes disabled prior to age 28 would generally need 1.5 years of work or 6 work credits to be insured and eligible for SSDI. And as you can see on the chart, the older you are, the more work credits you would need to qualify and become insured for Social Security. Next slide. So when should you apply for disability? The ideal answer is as soon as you become disabled. And the reason I say that is because the application process can be lengthy. So in order to get a jump start on the process, be sure to contact Social Security as soon as possible to limit the time you wait for a decision, as it can take anywhere from 3 to 5 months to receive a decision on a claim. And it also helps to have your doctor's contact information on hand during the interview, as this can also help process your application faster. Next slide. And we have several ways to apply. The fastest and most convenient method is to file your application online on our website, which is ssa.gov. Filing an application online provides the convenience of completing your application when you choose to do so, and you can start and return to the application as needed. But alternatively, you may also call our toll-free 1-800 number to schedule a phone appointment with a representative at your local field office. We determine your local field office by your mailing zip code. Next slide. So during the application process, you will be asked questions to determine your eligibility for either or both of our disability programs. And if we find you meet the non-medical qualifications, we then forward your claim to a state agency for a medical decision. Next slide. So the state agency will contact any doctors, hospitals, or clinics that you've been treated at for your medical records to make a decision on your case. And this part of the process is the lengthiest. So to help expedite the process, it helps to have the names, addresses, and phone numbers of all doctors you would like Social Security to contact for your medical records. Saves a little bit of legwork for the representative working the medical portion of the claim at the state agency. Next slide. So we use a 5-step process to make a disability determination. Number 1 being, are you working? So if you're working and your earnings average more than a certain amount each month, we generally won't consider you to be eligible for disability benefits. And this amount changes each year. However, for this year, it is $1,470 gross per month. Now, if you're not working or your monthly earnings average $1,470 or less, the state agency then looks at your medical condition. So step 2, is your medical condition severe? Now, for you to be considered to have a disability by Social Security's definition, your medical condition must significantly limit your ability to do basic work activities. So that could be something such as lifting, standing, walking, or sitting for at least 12 months or longer. Now, if your medical condition isn't severe, we won't consider you to be disabled. However, if it is considered to be severe, we proceed to step 3, which is, does your impairment meet or medically equal a listing? So our list of impairments describes medical conditions that we consider severe enough to prevent the person from completing substantial gainful activity, which is also another term for the monthly limit, that $1,470 per month that you can earn if you are still working while you apply for disability. So we measure that regardless of age, education, or work experience. So if your medical condition isn't on this list, the state agency looks to see if your condition is as severe as a condition on the list. And if the severity of your medical condition meets or equals the severity of a listed impairment, the state agency will decide that you have a qualifying disability. If the severity of your condition doesn't meet or equal the severity level of a listed impairment, then the state agency goes on to step 4, which is, can you do the work you did before? So at this step, we decide if your medical impairment prevents you from performing any of your past work. And if it doesn't, we'll decide you don't have a qualifying disability. However, if it does, we proceed to the final step, step 5, which is, can you do any other type of work? Now, if you can't do the work you did in the past, we look to see if there's other work you can do despite your impairment. So we will consider your age, education, past work experience, and any skills you may have that could be used to do other work. If you can't do other work, we'll decide that you're disabled. If you can do other work, we'll decide that you don't have a qualifying disability. Next slide, please. Now, once the state agency makes a decision on your claim, we do notify you by mail. So we send a letter to you to let you know if you're approved, how much your benefit will be, when your benefits are due to begin, as well as your reporting responsibilities. If your case is not approved, the letter will explain why, and it'll tell you how to appeal the determination if you wish to do so. In general, you have 60 days from the date you receive the denial letter to file an appeal in the case, in which it goes back to our state agency for another review and another determination. Next slide. Now, for millions of people, work isn't just a source of income. It's a vital part of who they are. It gives them purpose and pride and a connection to community. So we're here to help people get back to work if they're disabled by offering work incentives to individuals after they begin to receive disability benefits. And work incentives include, but are not limited to, continued cash benefits for a time while someone tests their ability to work, continued Medicare or Medicaid while they work, as well as help with education, training, and rehabilitation to start a new line of work if they decide that's something that they are interested in pursuing. So if you're receiving Social Security disability or SSI, let us know right away when you start or stop working. Wages must be reported to ensure your benefits are being accurately administered, and can be reported either by contacting your local field office or through your My Social Security account, which is available through our website. And I will get into more detail about how to set up and the features of having a My Social Security account in a few minutes here. Next slide, please. So now I'm going to talk about our other disability program, SSI, which is, again, is our needs-based program based on income and resources. The medical factors to qualify for this program are the same as Social Security disability. However, the non-medical factors vary quite a bit. So again, an individual filing for SSI must have limited income and resources. For the individual limit, it's less than $2,000 per month, and the couple's income and resources cannot exceed $3,000 per month. And as I mentioned earlier, individuals who are age 65 or older can qualify for SSI solely based on their income and resources, and do not need to meet Social Security's definition of disability, which again is referred to as an SSI aged benefit. Next slide, please. So as this is our needs-based program, we will consider your income and resources to determine your eligibility. So your income includes money received such as wages, Social Security disability or retirement benefits, and pensions. We also consider any resources, things you own, things that can be liquidated into cash, such as bank accounts, homes, or vehicles. And also where you live matters. You must reside in the United States or the Northern Mariana Islands. If not a U.S. citizen but lawfully residing in the United States, you may still be able to qualify if you meet certain factors. Next slide. Now, SSI designates income received into two categories, which are earned and unearned. And these two types of income are evaluated slightly differently. Earned income is generally considered to be wages from unemployment, wages from employment, could also be net earnings from self-employment or payment for services in a sheltered workshop, while unearned income can be Social Security benefits, whether that be retirement or disability, veterans benefits, unemployment, interest, pensions, or cash from family or friends. And normally the first $20 of unearned income received in a month is excluded as countable under SSI's rules, while the first $65 of earned income is excluded. And generally, the more countable income you have, the less your SSI benefit will be. And if your countable income is over the allowable limit, you cannot generally receive SSI benefits. Next slide, please. Now, resources are things you own and that have an applicable cash value. The value of your resources is one of the factors that determines whether you are eligible for SSI benefits. However, not all resources count for SSI. So resources that are included and countable are bank accounts. That also covers any CDs or IRAs, stocks, bonds, or 401ks, a second car, any life insurance policies, and property other than where you live. Now, we do exclude certain resources, the primary home in which you live, your first car, and also if you have any burial plots for yourself or your family or resources set aside for burial, those are all excluded and we do not count that as a resource. Next slide, please. Now, your living arrangement is another factor used to determine how much SSI you can receive. This means that your SSI benefits can vary depending on where you live. So whether you are in your own place, such as a house, apartment, or mobile home, living in someone else's household, in an institution such as a hospital or a nursing home, where typically the maximum benefit payable is $30 per month, or in a group care or board and care facility. So when you do apply your living arrangement, questions about your living arrangement and who you live with and whether you pay rent, mortgage, those are all factors that are considered. Next slide, please. Now, once an individual begins receiving SSI, it is very important for them to be aware of their reporting responsibilities, as changes in income or residency can affect someone's eligibility or their benefit amount. So any changes should be reported as soon as possible and can be done via telephone. We do have a wage reporting phone number that can be called. They can also be reported online through a personal My Social Security account. And we do also have a mobile wage reporting app that can be downloaded for people who have a smartphone. Next slide, please. So there are several options for applying for SSI, the easiest and most convenient way being online. So someone who meets the criteria below can apply online. Generally have to be between the ages of 18 and 65, never been married, must be U.S. citizen, and haven't previously had any applications for SSI. However, if an individual does not meet the requirements or maybe are applying for a subsequent time, they can always contact our toll-free 1-800 number for a telephone appointment with their local office. Next slide. So I'd like to change gears and just take a few minutes to talk about some of our online services by beginning with My Social Security. My Social Security is a convenient and secure suite of services that are designed to put you in control of your personal Social Security information, as well as help you manage your benefits when you do start to receive them. And your account gives you the information that you need at your convenience, and it's all without having to call or visit a local field office. So this is just a screenshot of the page that you would see when either creating or logging into your MySSA account, which again, you would go to right off of our main page on our website, ssa.gov. There's a button right on our main page where you can go to your MySSA account. Next slide. Now, one of the most beneficial features of having a MySSA account is the ability to obtain estimates of potential benefits. Having an account draws directly from your earnings record. So it provides really an individualized and extremely accurate estimate of what your disability benefit would be, as well as future retirement benefits. And you can get estimates as long as you have enough credits to be insured. And you can review your earnings record for accuracy, which I highly recommend doing periodically, as your earnings determine how much your benefit amount will be in the future. Next slide. So here are some of our most popular online services that you can utilize with your MySSA account. So for someone who already receives benefits or has Medicare, they can opt out of mailed notices for those that are available online. So they would stop getting paper notices and it would all be accessible through their MySSA account. They can request a replacement Social Security card, report their wages if they work and receive either SSDI and or SSI. They can get a benefit verification letter as proof that they receive benefits, which oftentimes are required or requested by various organizations and agencies. They can also check benefit and payment information, as well as their earnings record, change their address or phone number, start or change direct deposit, request a replacement Medicare card, and also request a replacement 1099 for tax season. Next slide. There are also a lot of great features for people who do not yet receive benefits. The My Social Security account is a great planning tool for disability and future retirement. So you can view retirement benefit estimates at different ages, view potential spouses' benefits. You can also request a replacement Social Security card even if you do not receive benefits with our agency. You can check the status of your application or appeal if you have one pending. And you can receive a benefit verification letter as proof that you're not getting benefits. And then finally, you can get your Social Security statement to review. And again, that's so important to do because we want to make sure that we have your earnings posted correctly and that you are receiving credit for every year that you work and did contribute and pay into the FICA tax, which helps not only get you insured for Social Security, disability, and retirement, but helps increase your monthly benefit amount that you would receive. Now, additionally, you can check us out on social media under the handle @SocialSecurity. We have a Twitter, an Instagram, a Facebook, and a LinkedIn page. And we share periodic updates to our programs and services that are really easily accessible online through those sites. Next slide. Okay. Oh, I know we were holding questions until the end of today's webinar. So I will pass it back to Andrea at this time. Thank you so much.
All right. Well, thank you, Jessica, for sharing that important information about Social Security disability. And I am now going to turn the call over to Diana to discuss PA-ABLE.
Thank you so much. Next slide, please. I'm Diana Fishlock. I'm an outreach specialist with the State Treasury Department. I'm also the mom of 2 young adults with disabilities. So we have ABLE at my house too. So I sort of understand ABLE from both sides. Next slide, please. Today I'll be talking about what ABLE is, who is eligible, how to open and manage an account, and a few additional rules for people receiving SSI. Next slide, please. Thank you. So ABLE is a special savings account for people with disabilities to use for qualified disability-related expenses. Those expenses are very broad. One of the most unique and significant features of ABLE accounts is that funds in the account are not counted when determining eligibility for federal means-tested benefits, with some limitation for SSI. Also, the savings get great federal and state tax advantages. Next slide, please. Through ABLE for the first time, many individuals with disabilities can save for a more secure future and have the ability to control their own funds. PA ABLE gives a number of investment options to the person managing the account, and funds in an ABLE account can be used for a wide variety of expenses. Next slide, please. ABLE stands for Achieving a Better Life Experience. ABLE was signed into federal law in 2014, and that enabled the states to create their own ABLE programs if they wished. Pennsylvania's ABLE program began in April 2017, so we're more than 6 years old now. And Pennsylvania's ABLE program has been one of the fastest growing in the country with a proven track record. More than 7,500 account owners have saved more than $90 million in assets. Next slide, please. As I mentioned, with an ABLE account, you can save while maintaining important benefits. The federal law says that assets in an ABLE account and qualified withdrawals from the account are not counted in any federal means tested benefit, with a limitation for SSI. Also, PA ABLE assets are not counted against Pennsylvania needs-based benefits having to do with disability, health, and student financial aid. This is extremely important because without ABLE, it was very limited how much individuals with disabilities could save and still receive benefits. Next slide, please. For example, traditionally, SSI recipients could only save $2,000 in assets without jeopardizing that benefit. Now, in addition to that $2,000, they can save up to $100,000 in an ABLE account, which can make a huge difference, giving the person the ability to save for a house or a car or just everyday expenses. If they go above that $100,000 threshold, SSI benefits will be suspended but not terminated, and medical assistance would continue through that time. ABLE account owners who do not receive SSI can save more than $500,000 in their ABLE account. Next slide. An individual can have only one ABLE account nationwide. While you may see information from other states, Pennsylvania's ABLE law has several PA-specific benefits. These are only available to Pennsylvanians if they use the PA ABLE program. Next slide, please. There are some nice tax benefits as well. Contributions to a Pennsylvania ABLE account are eligible for both state and federal tax benefits. Contributions to a Pennsylvania ABLE may be deducted from state taxable income up to $17,000 per person per year. Again, only contributions to the PA ABLE qualify for the PA state income tax deduction. Also, there's no state or federal income tax on PA ABLE account earnings while the funds are in the account or when they're withdrawn, as long as they're used for qualified disability expenses. Next slide, please. So let's talk about eligibility. There are two factors that go into eligibility. The first is the age of onset of the disability. So the person's disability needs to have begun by their 26th birthday. It doesn't matter what age the person is now or what age they received the correct diagnosis. So I could be 100 years old today and open an ABLE account as long as I qualified. That age is going to increase in 2026. It will bump up to age 46. But right now, the way the law is, a person's disability needs to have begun by their 26th birthday. The other factor is the severity of the disability. So if a person is eligible for supplemental security income or Social Security disability insurance, then they automatically qualify for ABLE. But if not, they can self-certify. Next slide, please. So with self-certification, in addition to the onset being by age 26, The person with the disability must have a written disability-related diagnosis from a physician who meets Social Security Administration criteria, saying that the person has a physical or mental impairment that results in marked and severe functional limitation and is expected to last at least 12 months or result in death. We at Treasury don't need this when you apply, but you would want to keep it on hand as an important document in case you're ever asked to show it. Next slide, please. Most people find that the easiest way to open an account is online. You can go to paable.gov and click on enroll. Completing the enrollment process takes about 15 minutes. In Pennsylvania, we also give people the option to fill out a paper application if they feel more comfortable doing that. You can print that out from our website, or you can call 855-529-ABLE and request a paper application, which we can mail to your house. There are some unique features on account control, and these were recently updated. So adults with legal capacity to enter into contracts may open the account for themselves, but they also may appoint any other person of their choosing to open and manage the account for them. If the person with the disability is younger than 18 or lacks the legal capacity to enter into a contract, their ABLE account must be opened by another person called the authorized individual in defined order of priority based on their relationship with the person with the disability. Federal regulations limit who can be an authorized individual to people in this list and in this priority. Someone with power of attorney, a legal guardian or conservator, a spouse, a parent, a sibling, a grandparent, or a Social Security Administration representative payee. Next slide, please. There are lots of ways to contribute to an ABLE account. You can use a paper check, money order, or electronic fund transfer. You can also link a bank account to your ABLE account. That makes it easy to take in and take out money. Anyone at all can contribute to an ABLE account. Family and friends can also contribute with UGift. Each ABLE account has a code, and it's a little bit like PayPal. So you can share your code with somebody and they don't need to know your account number, but they can put funds in. You can also roll over a 529 college and career savings account into a PA ABLE account with no tax implications. People who receive SSI or SSDI can direct deposit those into their ABLE account as long as they don't have a representative payee. And an ABLE account can accept up to $17,000 this year. Next slide. The Able to Work Act adds some wonderful flexibility for some account owners who are working, allowing them to contribute up to $30,590 this year if they have not made contributions during this tax year to a defined contribution plan like a 401k, an annuity contract, or a deferred compensation plan. Next slide. So we have investment options with PA ABLE. There are 6 asset allocation options that you see on this slide. They're all a mix of stocks and bonds and cash. They range from conservative to aggressive. A person managing the account can choose just one of these or any combination up to all of them if they want. If we can go to the next slide, I'll show you the checking account as well. So the checking account is offered through Fifth Third Bank NA, but account owners would enroll in that via our website or paper application, just like they would with the other investment options. The checking account comes with a free debit card. It's free to use at an in-network ATM or $2.75 at an out-of-network ATM. You also can order checks if you like. There is a $2 per month fee associated with the checking account, but that fee is completely waived if you choose to have your statement sent electronically, or if you have an average monthly balance of at least $250 in the checking account. And there's no overdraft or return payment fees. Next slide. So I'm going to go quickly through the next few slides just so we also have time for Q&A. This slide pulls the fees together so we're being transparent. PA-able accounts are free to open. All Pennsylvania able accounts have an account maintenance fee. If you receive information through the mail, that fee is $14.50 quarterly. But if you get e-delivery, that bumps down to $8.25 quarterly. Next slide. If you don't have the checking account, you can withdraw 3 different ways. You can go online and log into your account. You can call us, or you can fill out a form. But if you have the checking account, you have some added flexibility. You can use your debit card at a store. You can make a cash withdrawal at an ATM, or you can write a check if you purchase checks. Next slide, please. So one of the wonderful things about ABLE is that you can use it for a very wide variety of expenses. The federal law lists 11 categories shown on the slide, things like education, transportation, prevention, and wellness. Regulations also list basic living expenses. Expenses do not need to be medically necessary. We do encourage people to save all their receipts in case they are ever audited by the IRS. We don't need them, but you would want to keep those on hand. Next slide, please. Slide, if you could just buzz through the next few slides, please, because I do want to leave time for Q&A. Keep going. Yep, right there. Perfect. Thank you. So I just want to say we're here to help. If you have any questions, please reach out to us at 855-529-2253. We can accept relay calls. We'll be happy to send you brochures or do a webinar for your workplace or your support group. We also have periodic webinars, and we show you on the webinar how to apply online. So I'm going to end here so we have time for Q&A. And again, thank you so much for this opportunity.
Well, great. Thank you so much, Diana, for sharing that important information about PA-ABLE. I'm now going to turn the call over to Michael from the U.S. Senate Special Committee on Aging.
Thanks, Andrea. And as the audience probably can see, Jessica and Diana are just a wealth of information about Social Security programs and about the ABLE program, the PA-ABLE program. They're wonderful, wonderful contacts and resources. I'm going to try to do this in about 3 minutes. So as Diana said, we want to leave time for some questions. What I'm going to do is just walk through some very high-level policies that Senator Casey's been working on as the chair of the U.S. Senate Special Committee on Aging. And I'll start with ABLE. Diana mentioned that ABLE's eligibility will change soon because of the passage of a bill called the Able Age Adjustment Act. That bill passed in December and will increase the age at which a person can acquire a disability and be eligible for an ABLE account to before 46 years of age instead of 26 years of age. And that'll go into effect in January of 2025. The Senator is also working on 2 additional ABLE bills too. One is called ABLE Match, and you'll see that introduced in September. ABLE Match would make provide a match of a one to $1 match for people who don't have a lot of resources to put in a savings account, and help them to really boost up their able savings. If you make below a certain amount of money each year, for every dollar you would put in, you would get $1 matched up to a certain level. And that is just from the senator's point of view, that he really wants to encourage savings for everybody, not just those who have worked really hard and are lucky enough to be able to have some funds that they can put away. And then there will be later in the year a bill called Able Awareness, and that will be some funds to get out to states to make the general public even more aware of ABLE accounts and what the benefits can be of those. Diana is such a good spokesperson for all the great benefits that ABLE has. And from a federal point of view, we want to make sure that everybody in the country understands what a real benefit ABLE can be for the 14 million people who would be eligible for ABLE accounts after January of 2025. The second thing I want to highlight is some of the senators' work on Social Security. Jessica talked about the processes for applying for programs like Supplemental Security Income and Social Security Disability Insurance. The senator is working to make sure that there are funds for the Social Security Administration, to make sure there is good customer service, that there's responsiveness to questions, to when people have unexpected earnings, that they're able to report those earnings and not risk losing some of their benefits. So he's been working on both increasing some funds for increased quality of customer service, and then also to make sure that data collection is in place so we really know how the Social Security programs are supporting and affecting people in Pennsylvania and across the country. And then finally, I just want to say that in August, so next month, Senator Casey is going to hold a hearing in Pennsylvania that will focus on Social Security. We're not sure exactly the location yet, although we think it will be probably South Central Pennsylvania, maybe around the Johnstown or the Altoona area. And would encourage you to look for that hearing. The announcement of it will be on the Special Committee on Aging website. Or if you're in the area, you could stop by and attend the hearing as well. So thank you again to both Jessica and Diana for really highlighting the programs that they work on so well. And I'll turn it back to Andrea.
Great. Well, thank you for that information, Michael. So now I am going to provide an overview of how Senator Casey's office may be of assistance to constituents regarding Social Security issues and navigating federal agencies. Go ahead to the next slide. Thank you. Senator Casey's Office of Constituent Services consists of a team of constituent advocates who assist constituents who are experiencing issues with a federal agency. This includes, but is not limited to, Social Security benefits, missing passports, IRS problems, VA benefits, immigration snags, SBA concerns, and so much more. After receiving written permission, our office is able to follow up with a federal agency on a constituent's behalf to check on the status of pending claims or appeals, ask questions, relay information and concerns, and demonstrate Senator Casey's interest in a matter. Under the laws and rules of the U.S. Senate, we cannot force a federal agency to act in someone's favor. And it's important to note that if we cannot provide assistance, such as with a state or a private entity, we can refer constituents to someone who can best help. Next slide. With regard to Social Security disability, we can assist constituents who have questions regarding their appeal status, back pay, or overpayments. Overpayments can be caused by your marital or living situation changes, your income is more than you estimated, you are no longer disabled and continue to receive benefits, or you don't report a change to your status to Social Security as required. We can also assist with questions regarding supplemental security income, SSI, such as appeal status or income and asset limitation questions. Our office can also help with Medicare Parts A and B enrollment issues. Go ahead to the next slide. If you'd like to request assistance from Senator Casey's Office of Constituent Services, either with a Social Security question or for an issue with another federal agency, please do not hesitate to contact our office. You can reach us at the phone number 717-231-7540 or the toll-free number at 866-461-9159. You can also reach out via Senator Casey's website. So we will now open this portion of the presentation for questions for Social Security, PA ABLE, or Senator Casey's office. If you have a question, you can click the raise hand button at the bottom of the participants list to indicate that you have a question. I will call on participants that have questions one by one and unmute you. Please note that this is a public call, so we ask that you please keep your questions general. If you are having a specific issue, please feel free to contact us via the information currently on the screen. I'll just say again, if you have a question for any of our panelists, feel free to click the raise hand button at the bottom of the screen. Alrighty, well, not seeing any questions. If you do think of a question after the webinar, feel free to reach out to Senator Casey's office using one of those methods on the screen, and we'd be more than happy to answer your question or get you in contact with someone who can answer it. But thank you everyone for joining today's webinar. I hope you all have a wonderful rest of your day.